So we're looking at a really painful little lesion that sits in between the toes. It's called an interdigital corn. So this is an interdigital hard corn. So they're particularly painful because they sit in between the bones of the toes and they pinch the skin. And so over time, this hardens the skin, and what it does is it makes like a hard little stone or a pebble in between we call it corn or a halomadurum. So what we try and do, so short-term treatment for this is we go in there and clean out all the callus that's overlying it, and then enucleate the hard corn that's sitting in there, and that'll give almost instant relief. It'll still feel a little bit bruised if the surrounding tissue's been aggravated by the hard lesion. And then we just make sure we get it all out. I'm obviously not trying not to make this one bleed, but sometimes we get a little bit of blood with these. These are aggravated by people wearing narrow-toed shoes, or people that have got the fatty pads have worn out in between their toes. So obviously what we try and do then is get the patient to wear a broader, deeper toe box shoe, not to aggravate this. So anything like high heels or work boots that have got narrow toes or don't have deep enough toes can aggravate this. We can sometimes use a silicone prop to go in between the toes. We can custom make these or use off-the-shelf ones. They either work really, really well or they don't work at all, and there's not much in between. So we'll probably try one of those today as well, and then review this in about 2 or 3 weeks to do it again, and then we'll see how it's resolved. But you can see that we've got that out now. We'll just zoom in a little bit and see that, and we'll review this in 2 to 3 weeks.